Hello class, or classes, depending on who is watching this video. Welcome. I am going to do my best to give you an overview of vessels that can be tagged on models for your upcoming lab practicum number 3. Please remember that, at least for my class, you are to designate if it's left or right, and you must tell me if it's an artery or vein. If you are telling me it is left or right on a vessel that is not paired, you will be marked wrong. For example, you will see unpaired vessels in this video, like the superior mesenteric artery and inferior mesenteric artery. So be mindful if these vessels are paired or unpaired. This website I found has really good pictures of sheep hearts that are dissected, and you can click on label or have it just be the picture, which I find very useful for studying for the sheep hearts. So this is a pancreatic model. This structure here, let me put on my my pointer, my highlighter. And let me pick a color that will show up better. I'm trying to learn from my past videos. So let's just look at this model for the vessels. This little stub coming up here is the gastric artery, and what's not shown is up here superiorly would be the stomach. So gastric, stomach. It's an artery going to the stomach. This long vessel coming over here, this looks like a kidney, but it is not. It's the spleen. So this is the splenic artery. And then this little nub going up to the liver, which would be up here superiorly, is the hepatic artery. Then we have the superior mesenteric artery coming out underneath the pancreas here. You can also see the superior mesenteric vein coming up, and it's going to turn into, when it joins other veins from the stomach and spleen, it's going to turn into the hepatic portal vein. We'll see more examples of the hepatic portal vein, which is part of the hepatic portal system, in just a moment. So here's the same picture, but it's not labeled. Again, the gastric artery going up this way, splenic artery, hepatic artery next to the hepatic portal vein, and the superior mesenteric artery and superior mesenteric vein. This is the same model, but from a posterior view. Here's our hepatic portal vein, and I told you it turns into the hepatic portal vein once we have other veins merging from the abdominal cavity, like the inferior mesenteric vein, superior mesenteric vein, and here we have the splenic vein coming over. So once all those veins converge, it goes up into the porta hepatis. That's a fancy way of saying the entrance into the liver, through the hepatic portal vein. And I'll remind you that the hepatic portal system is a double capillary system, and it basically means we have a vein leading to a capillary that leads to another vein that leads to another capillary. Now, the first capillary was the capillary from all of your viscera in your abdominal cavity, where we had nutrient exchange. And then all of those veins, so here's the first vein, it could be either the splenic vein or inferior mesenteric vein, and they all merge into the hepatic portal vein, which will lead to a second capillary bed, the liver sinusoids, in the liver, and then all of that exits as the hepatic vein. So anyway, I just wanted to give a little overview of the hepatic portal system. Same model again. Here's the hepatic artery that would be going up, the gastric artery that would be going up, the splenic artery over here, superior mesenteric artery and superior mesenteric vein. And then up here we see the hepatic portal vein. a very similar model, except this one does not really show the gastric artery that would be going up. Instead, it shows the celiac trunk. It does still show the splenic artery and the hepatic artery. It shows the inferior vena cava running right next to the abdominal aorta. Here's our superior mesenteric artery and superior mesenteric vein. Another pancreatic model, we see the splenic artery. We do not see the gastric in this example. We do see the hepatic artery that would be coming up and entering the liver. This brown section here is just representing a part of the liver. I do like this model though because it does show you little branches of the left suprarenal artery and suprarenal vein. And over here, again, the right suprarenal artery and suprarenal vein. Down here, we see the superior mesenteric artery and the superior mesenteric vein. Again, this over here, this structure is the spleen. Behind it, posterior to it, we see the kidneys shown here in brown. This is the same model, but a posterior view. And we are seeing veins coming up from the gut. So this might represent the inferior mesenteric vein, if you will. Here is the splenic vein coming over to join, and up higher, when everything converges, it would be the hepatic portal vein. That's not shown on this model. This nub right here, this part that would be attached to the abdominal aorta, would be the celiac trunk. This little branch coming off of it would be going up to the stomach, so that's the gastric. That's difficult to type with. And here's our splenic artery. We're not really seeing, because we would need an anterior portion of this to see the hepatic artery. Here is the superior mesenteric artery coming off the abdominal aorta. And shown over here is the right renal artery and right renal vein, left renal artery over here, and left renal vein. This is our big torso model, and I'm going to go through the vessels just to orient you. This structure over here is the spleen. These brown structures are your kidneys. This creamy structure numbered number 26 is the left suprarenal gland or adrenal gland. Over here, this creamy structure would be the right. Here we see the abdominal aorta. The first branch off, this big branch, is the celiac trunk. And the one below it is the superior mesenteric artery. This little branch coming off to the right is the right gonadal artery, and this red one coming down and draping along the psoas major is the left gonadal artery. And those gonadal arteries are traveling right next to those gonadal veins that I am highlighting now. Please remember that the left gonadal vein dumps into the left renal vein, so you could see that I just highlighted it. This little nub here is the inferior mesenteric artery. Then the abdominal aorta branches off into the right and left common iliac. Then it branches again into the right external iliac, and you can see this part going deep into the pelvic bowl. That would be the right internal iliac. Because of the perspective of this picture, we can see the left external iliac artery, but we do not see the internal iliac artery going deep into the pelvic bowl as well. But we do see the median sacral artery shown here in the middle of the picture. Those external arteries, external iliac arteries, once they cross the inguinal canal, inguinal ligament, they turn into the femoral arteries. Same thing for the femoral vein coming back in. Once it crosses the inguinal ligament, it turns into the external iliac vein. So let's do it again. We can see our spleen. We can see our left kidney and our right kidney, the adrenal glands. Here is the left suprarenal vein. Here is the left renal vein and the left renal artery. Coming up here in blue that I'm highlighting now is the left gonadal vein. Over here in blue is the right gonadal vein, not brain. And then we see in red here the right gonadal artery and the left gonadal artery that I'm highlighting. Here's the inferior vena cava, the right renal artery, right renal vein. Here is the common iliac artery, the right side, common iliac vein behind it, left common iliac artery, left external iliac artery, and you can see diving into the pelvic bowl is the left internal iliac artery with the vein just deep to it. So here is our flat man model, and you should know that in cats, the internal jugular vein is very small and the external jugular vein is very big. Well, it's reversed in humans. This model, this particular portion of the model, is only showing you the left internal jugular vein, this entire thing. But don't worry, I have another model where you can see the external jugular vein more lateral to it. And the reason why it's not shown on this model right now is because the internal jugular runs next to the common carotid arteries. And those are very, very deep. Those are precious structures that we should preserve. The external jugular vein is more superficial. And again, I have another picture from another model coming up in just a moment. So here is our left internal jugular vein and our left common carotid artery. Down here we see our heart. We have the superior vena cava right here. This other blue structure here is the pulmonary trunk, which will lead to these blue branches called pulmonary arteries. They are arteries because they are carrying blood away from the heart, but they are colored blue because they are carrying oxygen-poor blood to the lungs for gas exchange. Shown right here that I'm highlighting now is the aortic arch coming off of the left ventricle. This little white thing that you're seeing inside the pulmonary trunk is the pulmonary semilunar valve. Over here is the right common carotid and right internal jugular. Then we see the subclavian artery and vein, that's the right, and over here, but they cut it away, would be the left. The left and right subclavian veins, when they join with the internal jugular, turn into the right and left brachiocephalic veins, which converge to form the superior vena cava, which in turn dumps into the right atrium. So here is another perspective of our torso model. And again, this one is showing you deep structures, vessels in the throat. It is not showing you the external jugular. So this whole thing is the internal jugular vein running right next to this left common carotid artery. Over here is the right common carotid artery next to the right internal jugular vein. Here is the left subclavian vein, right subclavian vein. They join with the internal jugular veins to form the left and right brachiocephalic veins, which in turn converge to form the superior vena cava, which dumps into the right atrium. Here we see the beginnings of the aortic arch, and here we see the pulmonary trunk leading to pulmonary arteries out here. In red, we see out here coming back from the lungs to the left atrium, the pulmonary veins, When they dump into the left atrium, there are 2 left pulmonary veins and 2 right pulmonary veins. We can see the left pulmonary veins in this perspective here because they're more anterior. The right pulmonary veins are more posterior and hidden. When we get to the heart models, I will show you those. But the definition of a vein, of course, is a blood vessel that brings blood back to the heart. And even though these pulmonary veins are colored red, they are still veins. They are returning blood, in this case, to the left atrium. They are red because they are bringing back to the heart oxygen-rich blood that has participated in gas exchange in the pulmonary capillary beds. So here is the same model, but it's not labeled, and you can test your own knowledge here by quizzing yourself. Of course, only focus on the blood vessels that you are responsible for. By the way, over here, number 1 is showing you, once the model is put back together, this is the right external jugular, and you can see how superficial it is on just kind of riding on top of the sternocleidomastoid. So this is not a model, but it is a nice picture to show you the difference between the internal jugular and external jugular veins. Again, the internal jugular, bigger in human than in cat, very deep, close to the carotid arteries, right next to it. The external jugular vein is more superficial, and it is smaller. And it's a nice picture because, like the model I just showed you before, you can see it dumping into the subclavian veins. And again, once we have all of the jugular veins dumping into the subclavian, then it turns into the brachiocephalic veins, and they converge to form the superior vena cava, which would be down here that I'm coloring in now. Oops. So I'm moving on to another model, and this is a nice abdominal model. I'm going to start over here. Here is where the celiac trunk would be coming off. This next one would be where the superior mesenteric artery would come off. We can see the right renal artery and right renal vein. And over here we see the left renal artery and left renal vein. These 2 small little nubs represent the right and left gonadal arteries that would be coming off. And here we see the inferior mesenteric artery. And this whole structure that I just highlighted on would be the abdominal aorta, and then it bifurcates into the right and left common iliac artery. The structure behind it represents the inferior vena cava, and you can see this tiny little nub here represents where the right gonadal vein would be dumping into directly the inferior vena cava. Over here, I'm going to point to it right there, is the little nub for the left gonadal vein, which I'll remind you dumps into the left renal vein. Here's a very similar model. It does show you the left suprarenal vein up here. It shows you again the celiac trunk. This little nub coming into the left adrenal gland represents a suprarenal artery. Here is the superior mesenteric artery. Hard to see because they were drawing a line, but right here that I'm circling would be the little nubs for the right and left gonadal arteries. And then down here we see the inferior mesenteric artery. Again, the right and left common iliac arteries. It branches into the right external iliac and the right internal iliac. And over here is the left internal iliac and the left external iliac. Once we cross the inguinal ligament, those external iliac vessels are now femoral vessels, shown down here. Coming back up, a vein, here's the right femoral vein, comes up through the lingual inguinal ligament, turns into the right external iliac vein. It merges with the internal iliac vein, very difficult to see in this picture, but over here is the left internal iliac vein for perspective, joining with the left external iliac vein, and that converges to form the common iliac. I encourage you to see the difference in human vessels with respect to the iliac vessels compared to cats. For the veins, for the iliac veins, human is identical to cat. But for the iliac arteries, common, external, internal, their presentation in cats versus human, very different, and you should know those differences. So going back to our flat person model, we can see internal jugular, right internal jugular dumping into. So they are dumping into the right and left subclavian veins, and once they do, this would be the right brachiocephalic vein and left brachiocephalic vein converging to form the superior vena cava. Here we can see the ascending aorta turning into the aortic arch. Over here we see the pulmonary trunk, which will branch off into pulmonary arteries. Here's the left. The right is tucking underneath the aortic arch. And this white thing that you're seeing here with 3 cusps is the pulmonary semilunar valve coming off of the right ventricle. And we can see here the right atrium, the right AV, atrioventricular valve, shown here in white that I'm highlighting. You can see chordae tendineae, papillary muscles, and we can see the right ventricle. I have better heart models to show you later on in this video. In blue, we are seeing branches of the pulmonary arteries, and in red, coming back to the left atrium, we see the pulmonary veins. Coming back up here to the shoulder and axillary region, down here we see the brachial vein coming up, and it dumps into the subclavian. Before that, this structure here would be the axillary vein. Deep to it would be the axillary artery that you're seeing, and again, we're on the right side. The axillary artery becomes the axillary artery after the subclavian artery, shown up here that I'm highlighting, gives a branch off called the subscapular artery, which we cannot see because in this model the lungs are covering it up. And the subscapularis, the muscle that the subscapular artery is serving, is on the anterior side, of course, of your scapula. So we're not seeing that perspective here. Moving inferiorly, in blue down here below the diaphragm is the inferior vena cava. I'm highlighting it, but I am using a blue highlighter. And we are seeing over here next to it the abdominal aorta. This would be the right gonadal artery and the left gonadal artery. This part coming off is showing you the inferior mesenteric artery. Well, actually, no, I take that back. That's showing you an iliolumbar artery. Up here, this part that I'm trying to circle right now is the celiac trunk. We see a part coming up this way for the stomach. That would be the gastric artery. Part going this way to the spleen, that would be the splenic. So I'm going to put G for gastric, S for splenic. And then this one right here going up into the liver is the hepatic artery. And the vein that is going with it would be the hepatic portal vein at that point. These veins up here that are dumping into the inferior vena cava represent the hepatic veins, carrying oxygen-poor blood, but blood that has been detoxified or cleansed, if you will, by the liver hepatocytes. Down here, we can see the left internal iliac artery and vein, and right internal iliac artery and vein that would be going into the pelvic bowl. This tiny little artery shown here in the middle would be the median sacral artery. Out here we can see the right external iliac artery and vein, and over here we see the left external iliac artery and vein. Over here we can see the right renal vein and right renal artery, and over here the left renal vein and left renal artery. A more up-close picture, which is very helpful, and you can see all those structures in better detail with this closer picture. So again, out here, this would be the brachial vein dumping into the axillary vein, and once it dumps in, it creates the subclavian, and once the internal jugular dumps into that, we get the brachiocephalic veins. Now, here's another flat model, as we call it, and you might, when you pull up your own personal PowerPoint that I'll supply you, you might want to expand this picture because it's hard to tell. I can't expand it myself right now. But if you look very closely, this small vein right here that I'm trying to highlight, that's the external jugular. And the bigger one right next to it is the internal jugular, and this would be on the right side. And you can see the internal jugular going right by the right common carotid artery. And then where the person's probe is attached would be the subclavian vein. And once the jugulars dump into it, becomes the right brachiocephalic vein, and over here is the left brachiocephalic vein. Coming up here is the brachial vein, and when it dumps in here we have axillary, and then again eventually the axillary turns into the subclavian once the subscapular vein dumps into it, which again we can't really see very well here. So we have axillary, more lateral to this person's probe, and then more medial to it would be the subclavian vein. Down here you can use the other picture I provided for a more up-close abdominal cavity vessel review. So here is the same up-close picture again for you to look at. It's got more of the abdominal pictures or abdominal vessels that I just referred to. Up here we can see the celiac trunk giving off basically gastric artery, splenic artery, hepatic artery, merging with the hepatic, or not merging with, but traveling with the hepatic portal vein into the porta hepatis. Up here we see hepatic vein dumping into the inferior vena cava. This purple structure coming up shows you the superior mesenteric vein, which will merge with other veins from the stomach, from the spleen, etc., to form the hepatic portal vein. This little nub coming out at you would be the superior mesenteric artery. Here is the left renal artery and right renal artery. Here's the right gonadal artery, left gonadal artery. Oh, and so I take that back from a previous picture. This is a better perspective. This is trying to show you the inferior mesenteric artery. So let me go back if I can. No, it's not because I'm recording, but earlier I started to say that looked like the inferior mesenteric artery, and then I corrected myself saying maybe it's supposed to represent iliolumbar, but iliolumbar vessels are paired, so I take that back. This is showing you the inferior mesenteric artery. Because this is a flat model, I guess they chose to show it being pulled over to the side instead of a little nub coming out at you like most models show, like similar to the celiac trunk and superior mesenteric artery where they just kind of cut it off. So I apologize for that. Here we have our right common iliac and left common iliac, right external iliac, left external iliac, right internal iliac artery next to the vein, and left internal iliac artery next to the vein, and then median sacral artery. So to go back again, this is what I was referring to, where usually models show the unpaired vessels just as little stubs on the models coming right out at you. So here's our celiac trunk. Here's our superior mesenteric artery. Tucked underneath here would be the left and the right renal vein, or sorry, artery. Here's the left renal vein and right renal vein. You do this over and over many times, you're going to make mistakes eventually. So again, left renal vein, right renal vein. Here is our left gonadal vein dumping into the left renal vein. Here is our right gonadal vein dumping into the inferior vena cava. Here is our right gonadal artery and our left gonadal artery. And here is the inferior mesenteric artery, that little bugger that gave me such a problem a couple slides ago, where usually they just show it as being cut off, but in the previous slide I just showed you, and in a prior slide they showed it going off to the left like that, and at first I called it the iliolumbar, but again, iliolumbar arteries and veins are paired. Down here you're seeing the common left common iliac, right common iliac, and these holes here are representing where the internal iliac vessels would be coming off of the common iliac or joining into the common iliac in the case of the vein. Again, see, here we go. The inferior mesenteric artery, that little bugger that they decided to show coming off the left like that. So there it is again. And then here we have the left gonadal artery. Over here, not labeled, is the right gonadal artery. This would be the abdominal aorta right on top of the inferior vena cava. Here's the left common iliac and the right common iliac artery on top of the vein. Here is the left internal iliac artery on top of the left internal iliac vein. After that branch, this becomes the external iliac. And on top of the external iliac vein, once they cross the inguinal ligament, it is the femoral artery, femoral vein. So again, here, right around here would be the inguinal ligament. So down here, we now have femoral artery and right femoral vein. This large superficial vein shown here on the right side is the great saphenous vein. And this artery that's traveling right next to it, also superficial, would be the saphenous artery, again on the right side. Coming off the femoral artery, going deep, shown here, almost, it looks like it's going behind the femur, is the left deep femoral artery. Over here, it would be this structure right here that I'm highlighting, and the vein that's right next to it, where it looks like it's going behind the femur again, would be the right deep femoral vein. So here is the same model, just a different perspective instead of being shown from the side. Let's start with the great saphenous vein running with the saphenous artery. Here we have the femoral artery. Here's the left and here's the right. And going deep here would be the left deep femoral artery. And here's the right deep femoral artery, and just next to it, traveling with it, is the right deep femoral vein. Here is the right femoral vein coming up. Once it crosses the inguinal ligament, it turns into the external, in this case I'm showing you the right external iliac vein traveling next to the right external iliac artery. Up here we're seeing a branch of the median sacral artery. And up here, we're seeing the internal iliacs going deep into the pelvic bowl. Moving on to other models, this is another liver model. I have quite a few to show you. First of all, this part right here is showing you the inferior vena cava, and this part, this vein coming into it, is representing a hepatic vein. Right here we see the celiac trunk with 3 branches, one going this way, a little tiny piece. The structure over here is a cross section through the stomach, so that would be the gastric artery. Then we see this one coming over here, that's the splenic artery. And then we see an artery coming up into the liver, and that's the hepatic artery. Remember, when it enters the liver, it's traveling right next to the hepatic portal vein that I just circled right there. We see the superior mesenteric vein coming up, and then here's the superior mesenteric artery coming down. Another perspective, a different liver model. This is your inferior vena cava. This is your hepatic artery traveling right next to, in purple, your hepatic portal vein coming into the liver through an entrance called the porta hepatis. This is another model that we have in our lab. Again, here's the inferior vena cava. This blue structure dumping into it represents the hepatic vein. This little nub coming out at you, or that would be going towards you, is the hepatic artery. Traveling right next to this structure in purple, the hepatic portal vein. They would be entering the liver through the hepatic, the porta hepatis. Moving on to different models. This is a heart model that we, of course, have in our lab. We can see the ascending aorta turning into the aortic arch. Here is the ligamentum arteriosum, an artifact of fetal blood flow, which you should know for your Lab 3 exam. There are 3 branches off of the human aortic arch. That's different than what we saw in cat. We see the brachiocephalic trunk, which branches into the right common carotid and right subclavian artery. We see the left common carotid and left subclavian artery. Here, coming off the right ventricle, is the pulmonary trunk, which bifurcates into the left and right pulmonary arteries. They are blue, so don't let that confuse you. They are bringing blood away from the heart, but it is oxygen poor. Right here is the superior vena cava, but you can see the left and right brachiocephalic veins dumping into the superior vena cava. We can see the auricle of the left atrium and the auricle of the right atrium. We can see branches of the coronary circulation. This branch right here is the left coronary artery, and over here that I'm highlighting is the right. The left coronary artery is very short. It immediately branches into the circumflex and the anterior interventricular artery. And the right coronary artery, of course, will branch off into the right marginal artery. They don't have it labeled, but that's what it would be. And another model that we have, you can see the ascending aorta into the aortic arch, brachiocephalic artery, left common carotid, left subclavian. Here is the pulmonary trunk bifurcating into the left and right pulmonary arteries. Over here, you can see the paired pulmonary veins. There would also be 2 coming from the right side, but you can't see it because they're more on the back side of this model. In white here would be the ligamentum arteriosum. This 3 cusp valve that you're seeing in the right ventricle is a pulmonary semilunar valve. Here we see the right atrioventricular valve. The strings are the chordae tendineae. This thumb-like looking muscle is a papillary muscle. I can see more over here in the left ventricle. This valve I'm highlighting is the mitral valve, also known as the left AV valve, also known as the bicuspid. So I would know all 3 terms. Again, the little strings are the chordae tendineae. They, along with the papillary muscles, help prevent eversion of these valves. That would then, if they did evert, we would have blood flowing backwards, we call that regurgitation, from the ventricles back into the atria. Way up here, tucked way up high in the left ventricle, we're seeing the aortic semilunar valve way up there, up high. All of this bumpy looking muscle is called the trabeculae carneae. Up here we're seeing the auricle of the left atrium and the auricle of the right atrium. Again, we are seeing the right brachiocephalic vein and left brachiocephalic vein, and when they merge, they form the superior vena cava. The outermost layer of the heart is the epicardium. All of this middle layer of the heart, where we have all the cardiocytes, all of this would be the myocardial layer. And all of this internal layer that's colored a light pink color, and even the valves are made of this type of tissue or layer, is the endocardium. Similar model, just opened up. I'm going to highlight some structures I haven't highlighted already. We can see the pectinate muscles that are give the bumpy appearance to the atria. Again, the bumpy material down here in the ventricles would be the trabeculae carneae. Those thumb-like muscles I highlighted before, the papillary muscles. We can see our bicuspid and tricuspid valves up here, the pulmonary semilunar valve. Can't see in this perspective the aortic semilunar valve. Shown in red, coming down the anterior interventricular fossa, we see an anterior interventricular artery and the great cardiac vein that travels with us. Not fossa, sulcus is what I meant to say. Same model, just the posterior perspective. Here are the right pulmonary veins that I told you we couldn't see until we turned the model over. Here's the inferior vena cava dumping into the right atrium. This structure here is the coronary sinus, which dumps the blood, oxygen poor blood, from the heart into the right atrium. On the back side here, we're seeing the posterior interventricular artery and the middle cardiac vein traveling right next to it. That would be these structures right here. Let's see. This part of the aorta is after the aortic arch, so this is now the descending thoracic aorta, and you need to be specific. You can't see that they're paired because of the model being turned too much, but that would be the paired left pulmonary veins. Same model, but now we're looking specifically at the left side. Number 1 is showing you the aortic arch. Number 2, ligamentum arteriosum. Number 3, pulmonary trunk. Number 4, the left paired pulmonary veins. Number 5 is showing you the left atrium. Number 6 is showing you the fossa ovalis, a remnant of fetal blood circulation. It used to be the foramen ovale. Number 7 is showing you the left atrioventricular valve, also known as the mitral valve, also known as the bicuspid. Number 14 is showing you the myocardial layer of the left ventricle. Number 13 is showing you the trabeculae carneae. Number 9 is just showing you the space of the left ventricle. Number 10 is showing you a bundle branch coming down the IV septum. Number 12 is showing you the myocardial layer of the IV septum. That stands for interventricular septum. Number 11 is showing you Purkinje fibers traveling in the left ventricular wall. And number 8, way up here, is showing you the aortic semilunar valve. Another heart model that we have, I like this model because the thumb-like muscles of the papillary muscles are very noticeable. We can see the IV septum. We know which side is left and which side is right because we can compare the myocardial thickness of these lateral walls. This is thicker than over here, so this all over here is left. And all over here would be right. This would be the pulmonary semilunar valve then up here. See the right atrium, left atrium. We see the pulmonary trunk coming off of the pulmonary semilunar valve. Let's see, these string-like structures are representing the chordae tendineae, and those anchor into the AV valves shown here, and they're being shown closed. Okay, now we're getting into the sheep models, or sorry, sheep hearts. We're done with the models. The first thing you always do is find the IV septum. So here's the IV septum separating the left versus the right. How did I know that? I compared the thickness of the lateral walls. So the left wall of the left ventricle is much thicker, you can see, than the right ventricular wall. We can see the large thumb-like muscle in the left ventricle here. That's a papillary muscle. We can see the strings anchoring into the papillary muscle and also the left AV valve shown here. Here is a cusp and another cusp. The third one has been sliced away. It would have been up here somewhere, of the aortic semilunar valve. Over here, we would be in the right the right ventricular chamber over here, and they've sliced through it. We're going to see in another picture that this little structure here that looks like a piece of muscle going from the IV septum to the right ventricular wall, well, that's called a moderator band, and it's basically, it's not always present. Your instructor might not want you to know it. I don't ask my students to know it, but it is part of the conductive system. Over here, you can see the tiny little moderator band in this heart over here. So again, IV septum, compare the lateral wall thickness to orient yourself if you're left or right. This is much thicker, this myocardium, so this is left. And over here, this is right. You can see a large papillary muscle here. The chordae tendineae anchored into the mitral valve. Way up here would be the aortic semilunar valve, and here's another cusp of it. Here is the right AV valve, also known as the tricuspid valve, and this space superior to it would be the right atrium. And this space superior to the left AV valve would be the left atrium. And down here, the most narrow point, the pointiest part, is the apex. The widest part of the heart is considered the base. Here is the heart again, filleted open. I encourage you to test yourself. Find the left versus right chambers. Your starting point is always the IV septum that I'm highlighting now. Your next step is always to compare the thickness of the ventricular walls with each other. So the thicker one would be the left side, and here's the other half of the heart that you can compare the ventricular walls to. Way up here, this little cusp that we can see is part of the aortic semilunar valve. How did I know that was aortic? Well, this is the left side. We don't have a good perspective of the pulmonary semilunar valve, but I will get to a picture where you can see that better. We can see chordae tendineae. We can see, in this case, the left AV valve, bicuspid or mitral. Here it is on the other side. And right over here is a portion of the right AV valve. And over here, again, another portion of it, also known as the tricuspid. So again, just to help you, IV septum, compare the thickness of the lateral ventricular walls. Clearly, this is the left side. This would be the right side. And here's a model just to compare that as well. Much thicker over here than over here. Another dead giveaway for the model is we have the pulmonary trunk. Pulmonary trunk comes off of the right ventricle, and here we see the pulmonary semilunar valve. So here is Another heart filleted open. Look carefully. I'm highlighting right now the IV septum. We can compare the thickness of the ventricular wall. This person's thumb is hiding a lot of the ventricular wall on this side. This is a lot thicker, so this is left. And over here, that would be right. We can see chordae tendineae in the left ventricle here. Way up here, coming up here, we can see two of the cusps for the aortic semilunar valve. Over here, we're seeing the left atrium, thick lateral ventricular wall. Here is the IV septum. Here is the mitral valve, also called bicuspid, also left atrioventricular valve. We can see clear as day these nice stringy structures are the chordae tendineae. We're seeing some of the bumpiness of the trabeculae carneae in the left ventricle. And this smooth cusp that you're seeing here is the aortic semilunar valve. So this would lead then to the aorta. Now this picture is showing you the right side of the heart. We're seeing the right atrium, which has very little pectinate muscle compared to the left atrium. We can see the opening of the coronary sinus, which is dumping oxygen-poor blood from the heart back into the right atrium so that it can go into the right ventricle and out through the pulmonary trunk to go and participate in gas exchange. Here we're seeing the right ventricle filleted open. So this whole space here is showing you the trabeculae carneae and papillary muscles that would be in the right ventricle. And this is showing you the tricuspid valve. This picture over here is still showing you the right side of the heart. Number 4 is showing you that moderator band. Number 5 is showing you one of the leaflets of the tricuspid, and we can see the chordae tendineae here. We can see trabeculae carneae. Over here that I'm highlighting would be the IV septum. Number 2 would be part of the left ventricle, and here we see the apex of the heart. Number 3 is showing you the anterior interventricular sulcus. Number 1 is showing you the right atrium. Number 6 is showing you the pulmonary trunk. And number 7, you can see the cusp of the pulmonary semilunar valve. Number 5, again, is showing you a leaflet of the right AV valve. These are 2 pictures taken from that website that I referred to at the beginning of this PowerPoint lecture. This same picture, one is more expanded, blown up than the other. So I'm going to just highlight the one that's more expanded. Here is a moderator band, and it connects the IV septum, where we have conductive cells, to the lateral, this is the IV septum over here. And the moderator band is connecting to the lateral right ventricular wall. We can see the leaflets up here of the right AV valve with the chordae tendineae. Here we see trabeculae carneae, the bumpy appearance. And this is one cusp and a second cusp and a third cusp of the pulmonary semilunar valve, and the blood would be ejected from the right ventricle into this structure, which is the pulmonary trunk that has been sliced open a little bit. So again, a cusp, and a third cusp for the pulmonary semilunar valve. This would be the pulmonary trunk. Here is the IV septum. Here's our moderator band. Here is the right lateral ventricular wall. We can see trabeculae carneae. You can see chordae tendineae. Down here are the thumb-like muscles we call papillary muscles. And this structure is the right atrioventricular valve, also known as the tricuspid. All right, I think that's enough. Thank you all for joining me.